Hello students, I am Dr. Saleha Jamal, Faculty Department of Geography from Aligarh Muslim University, Aligarh. Today's topic of discussion is climate change and its impact on health, a global perspective on environmental and health challenges. This is very important theme and I am going to talk about the climate change and its related impact where we are very much impacted, means we as a human being are directly or indirectly impacted by the climate change with respect to the health. We know that the climate change has been regarded as one of the greatest threat to health. Even the World Health Organization has identified the climate change as the greatest threat to the health in the 21st century, affecting the health and overall well-being in variety of the ways. When I talk about the variety of the ways, we know the climate impact the various elements of the environment. If we talk about the clean air, safe drinking water, sufficient food, secure shelter, these all aspects or elements have been impacted by the climate change, and overall it affects the social and the environmental determinants of the health, because all these things, the clean air, safe drinking water, sufficient food, secure shelter, these all things are regarded as very important social and environmental determinants of the health. According to World Health Organization, climate change will cause 250,000 additional deaths per year between 2030 to 2050. This is a huge figure we are talking about. Means already we are impacted. We are seeing the repercussions of the climate change in the death, so several death tolls, human injuries, property loss, etc. But still it is predicted that this human toll, or we can say overall climate change will cause around 250,000 additional death per year between 2030 to 50, which is a huge number. No one globally is free from the climate change. It is impacted in one way or the other way. If we talked about the vulnerable groups, whether the women we talk about, whether we talk about the children, whether we talk about the elderly, marginalized community, displaced persons, we talk about the individuals with pre-existing health disorders, or even the people living in poverty, these all together that contributes or increases the susceptibility towards the climate change. These are the most vulnerable sections of the society. So, as we are talking about the health and climate change relation, it becomes very important to talk about how climate change is altering the disease burdens. When we talk about the climate change altering the disease burdens, it can be analyzed through the various aspects. We have seen that the climate change is increasing various heat related illness and deaths, because climate change can directly be seen through the global rise in temperature, changing weather patterns, etc., where we have seen the increased frequency of heat waves also. Thus, it impacts the heat related illnesses through, like we can say, heat strokes or exhaustion through the high temperature, etc. Thus, it alters, we can say, climate change is altering the burden of diseases. Climate change is also shifting the infectious disease transmission patterns. For example, mosquito-related diseases, ticks-related diseases. We know that these vector-borne diseases, these like mosquitoes, they mostly breed in warm, either we can say high and humid temperature. So, global rise in temperature, changing patterns of the rainfall, this causes expansion in the region where this disease were not previously reported. Thus, it also exacerbates the infectious disease transmission patterns by by contributing to the expansion of mainly the vector-borne disease regions. Climate change is also altering the disease burdens through the deadly diseases outbreaks and pandemics, which we have recently observed and we have even seen in various decades. Recently, we have seen about the COVID, COVID pandemic. Even it is worsening the maternal and the child health outcomes. These all things we are going to discuss one by one further in our lecture. If we give a look, every region, every country, they are having their own climate risks. For example, here you can see some of the regions, they are mainly impacted by the hurricanes. Some of the regions are impacted by the wildfires. Some of the regions are impacted by the extreme heat. Some of the regions are impacted by the droughts, while some of the regions are impacted by the floods. Means every country is having their own climate risk, and accordingly they are mostly prone to related health problems. Let us talk about how climate change affects health. Actually, climate change impacts health through the direct and indirect pathways. It may affect the physical, mental and social well-being either directly or indirectly. And the effects are multifaceted. As we know, environment changes lead to the cascade of health issues, and climate change is impacting the overall environment, whether we see in terms of the temperature, precipitation, in terms of the pollution, etc. Let us talk about the direct effects in terms of the heat waves. Rising global temperature, that is increasing the frequency and intensity of the heat wave, which leads to the heat related illnesses, particularly heat exhaustion, heat stroke and even many times in extreme cases to death, particularly among the vulnerable groups like the elderly or the people who are already suffering from some pre-existing conditions. Indirect impacts, we can also talk about the extreme weather events like the storm, floods, drought, wildfires. These events causes injuries and many times deaths and displacement also, which disrupt the healthcare services and infrastructure, leads to most of the increase in the number of injuries and many times in extreme cases increase in the number of deaths. Let us talk about the indirect effects, how this climate change is affecting health indirectly. As we know that we are greatly exposed to our environment, and the climate change is causing various types of changes in our environment. Let us talk about these changes. First one here is air pollution. Climate change is aggravating the air pollution, which have been observed in terms of increase in the ground level ozone, increase in the particulate matter. These all things worsens the respiratory diseases like asthma, chronic obstructive pulmonary diseases, bronchitis, means directly it impacts the respiratory diseases. Even in indirect effect, we may also talk about spread of vector-borne diseases. We know that global rise in temperature, warmer temperature, alteration in the precipitation pattern, due to which expansion in the habitats of disease-carrying vectors have been observed. For example, mosquito, ticks, these are leading to a spread of diseases like malaria, dengue, Zika, Lyme, etc. So, these here you can see expansion in the regions which have not been previously reported or have been observed. Let us talk about here how climate change can affect people by changing their exposure to health threats. Let us talk about, if we talk about the climate impacts, it impacts to the environment and the institutional context. Its impact can be seen in the social and behavioral context. If we see the impacts of the climate in terms of the environmental and institutional context, we know lots of land use changes is going on, ecosystem is being deteriorated, depleted, heavily affected by the climate change. It has disrupted the infrastructure conditions, also several we can say unsustainable agricultural practices that is heavily practiced. So these are all we can say impacts of the climate change on the environment. When we see in terms of the social and behavioral context, we can see the certain vulnerability aspect with respect to the age and gender, race and ethnicity, mainly the vulnerable section regarding the poverty, housing infrastructure, which type of housing structure the individual is living, discrimination in society, education level, access to care and community health infrastructure, pre-existing health condition. These all things affect the health of the human being, and these are all impacted by the climate change. If we see the direct impacts of the climate change, it can be observed in increased temperature, precipitation extremes, extreme weather events and in sea level rise. These are all we can say direct impacts of the climate change, and exposure to all these conditions what we have talked about, whether the changes in the environment, whether the changes in the social and behavioral context, or whether we can say the changes, direct change, climate impacts that leads to extreme heat, poor air quality, reduced food and water quality, changes in the infectious agents, population displacements, etc. So these all together they lead to the health outcomes like health related, heat related illness, cardiopulmonary illness, mainly the respiratory illness, food, water and vector borne diseases, mental health. So here at a glance you can understand how climate change is impacting the human health. What are the indicators that tells about the climate change and the human health? For saying something, we need to have authentic data, and these authentic data are generally derived through the various sources with the help of certain indicators, analysis, etc. So here we are going to talk about what are the certain indicators which tells about the climate change and human health, how they are related. Actually, these indicators, they provide the measurable data that can be tracked over time in order to assess the changes of environmental and the health outcomes. That's why measuring the indicators and its related outcomes with respect to the climate change and health is very much important. Let us talk about the first very important indicator is temperature related health impacts. If we talk about the indicator, the frequency and intensity of heat wave is increasing due to the climate change, what the data says. And what it tells about us, if the global temperature is increasing, it is leading to the more frequent and the severe heat waves, which correlates with the rise in the heat related illness and the deaths, particularly among the vulnerable population like elderly, children or those with the pre-existing health conditions. Second most important indicator is air quality and respiratory health. It becomes very much important to monitor the level of pollutants like certain toxic gases, or we can say particulate matter, 2.5, ozone, allergens, etc. We know that the climate change aggravates the poor air quality by increasing the ground level ozone, by extending the pollen season, etc. Now these pollutants are directly linked with the certain respiratory diseases like asthma, bronchitis, chronic obstructive pulmonary diseases, etc. Thus, it becomes a very important indicator. Another important indicator here is a vector-borne diseases, because we have seen the shifts in the geographical range and the seasonality of disease vectors like mosquitoes and ticks. It tells about that warmer temperature, altered precipitation, these are expanding the habitats of the vectors like mosquitoes and ticks, which increases the risk of the spread of certain diseases like malaria, dengue, Zika, Lyme diseases, etc. The three indicators what here we talked about, that is the temperature, air quality, vector-borne diseases. Uh, these are very important example which even show how climate impacts can affect health. Let us see from this figure where the numbered circles identify where climate change indicators provide key information on changes occurring at different points along the pathways. Let us see the climate impacts in terms of the extreme heat, flooding and tick-borne diseases. If we see in terms of extreme heat, we know due to the climate change, more frequent, severe and prolonged heat waves are being observed. Mainly the high and low temperature fluctuations are being observed, and it can seize it can be observed through the US and global temperature monitoring, because these circles, particularly the yellow circles, mainly identifies where the climate change indicators provide a key information on the changes occurring at different points along the pathways. So these leads to the exposure of elevated daytime and nighttime temperature, which leads to the certain health outcomes, that heat related deaths and illness. Similarly, if we talk about increase in the extreme events like flooding, rising sea levels, heavy precipitation, more intense tropical cyclones, this all lead to contaminated water and debris from the flooding, which another leads to the certain health outcomes, for example, gastrointestinal diseases, illness and the injuries. Similarly, if we talk about the tick-borne diseases, means vector-borne diseases, and we have seen there is this climate change is expanding the habitats of the vector, the changes in the extreme temperature, precipitation and seasonal weather patterns, that is leading towards the expansion of the vector borne disease region. This lead to the disease carrying ticks earlier in the season and in very much also new parts of the different countries, and several outcomes can be seen in terms of health outcomes can be seen in terms of the dengue, malaria, Lyme, etc. Now, fourth important indicator here we are going to talk about is the water and water related diseases. This indicators mainly talks about the climate change which exacerbates the water quality issues through the extreme weather events. Water quality issues which is very much related with the extreme weather events like the flooding, drought, which leads to the contamination of the drinking sources. Even the high temperature also promote the growth of harmful bacteria in the water bodies, and it leads to certain incidents of waterborne diseases like cholera, typhoid, diarrhea, etc. Let us talk about, after knowing how the climate change is related to the health impacts of the human being, let us talk about who is at risk. Which section of the society, community, age group, gender is at risk? Actually, the climate change we know that poses a risk directly or indirectly to an each and every individual, but some people, however, they are larger at risk as compared to the other. This difference is mainly seen because the differences to the hazards to which they are exposed. Means some of the community is exposed to the flooding hazard, some of the exposed to the drought related hazard, some communities are related to the extreme rise in temperature hazard. These are, we can say, how differently they are exposed to the different hazards. The differences also occurs due to their sensitivity to these hazards. Some people are more resistant, some people are sensitive to the hazards. And the third difference comes because of the adaptability. We know mostly the more resilient sections or society who adapt to the climate change are the developed societies, developed communities, developed region. The poor people, the poor communities, as they have less access to the resources through which they can develop adaptation towards the climate change, they become more vulnerable. So mainly if we talk about who is at risk, we have to say that each and everyone is at risk, but this risk for some people it is larger and for some people it is smaller due to the differences like to the events or hazard to which people are exposed, according to the sensitivity of the people and according to the adaptive capacity of the people. So thus it becomes very much important to identify the population which are to be given more priority during the mitigation with the climate change, which mainly includes the groups of the individuals of ages, mainly the elder people, mainly the women, the younger ones, or the people who are already suffering with some health issues. These are the most vulnerable section of the society. If we see here which are the most vulnerable section of the society and what determines the vulnerability, the three things we talked about is the exposure, sensitivity, and the ability to adopt. Exposure is a contact between a person and one or more biological, psychosocial, chemical, physical stressors, including the stressors affected by the climate change. Means the interaction with the certain stressors. Those stressors may be physical, psychosocial, chemicals, or even the stressors that is affected by the climate change. Thus, this defines the exposure. When we talk about the sensitivity, it actually defines the degree to which we as a community are affected. Some communities, individuals are more affected and some are less affected. So, here we can sensitivity also defines the vulnerability. Talking about ability to adapt, that refers to the adaptive capacity which the communities, institution, or the people have to adjust with the potential hazards that is mainly aggravated by the climate change. So thus these three aspects determinants exposure, sensitivity, ability to adapt, that defines the vulnerability of human health to climate change, which can be seen in differential outcomes, health outcomes in terms of the injuries, chronic illnesses, maybe mental, respiratory, digestive, gastrointestinal, etc. So here we are going to give certain examples regarding the climate change, extreme weather events with certain examples how it is very much related with the health impacts. Let us talk about the rising temperature. We know due to the climate change, global temperature is rising. Global warming has led to the significant increase in overall Earth's average temperature, which contribute in the increase of the frequency of the heat waves. We can give example of 2019 and 23 heat waves in Europe, in Asia, which was not very much common if we analyze the previous decades heat waves events. And impacts can be seen in terms of heat-related deaths, cardiovascular stress, reduced labor productivity, etc. Talking about the extreme weather events like storms, hurricanes, heavy rainfall, storm surges, etc. And if we give example here, increase in the category 4 and the 5 hurricane, category 4 and 5 means very much disastrous hurricane. Increase in the category of 4 and 5 hurricane in the Atlantic that have been observed here. And impacts can be seen in terms of physical injuries, drowning, trauma, and loss of lives. This figure clearly explains the rising global temperature. Here you can see year wise, and here you can see increase in the carbon dioxide level, which is very much related to the temperature anomaly. Here you can see consistent rate of increase of temperature, and on average 2023 it has been 1.17 degrees centigrade, which can impact the different aspect, different functions of this planet Earth. Talking about the extreme weather events like flooding and storm surges, which have increased due to the climate change, we know due to the rise of sea levels. If we give here example, 2022 floods in Pakistan, 2023 hurricane in Idalia in US, and the health outcomes of these flooding and storm surges can be seen with respect to the contaminated water sources, spread of waterborne diseases, displacement, and homelessness. Another extreme event of drought and wildfires, we know that rising global temperature leads to prolonged drought condition in which leads to increased wildfire frequency in the regions like Australia, California, Mediterranean. The health impacts can be seen in terms of the respiratory issues from the smoke inhalation, malnutrition due to the crop failures, food insecurity, mental health stress, and even the loss of homes and the livelihoods. So these are the few examples. Even you can give more examples. I have just talked about the few examples that you can give how the changes in the climate, or overall we can say climate change, is impacting human health. So we have seen in this lecture that human health are directly or indirectly very much related to the climate change. So that's all for today's lecture, student. Have a nice day and thank you.